Welcome to our third part of our four-part series, all about how to support your child with their sleep. In this video today, we're going to be looking at some common bedtime problems which you might be experiencing with your child. I'm going to offer some tips and solutions that you can try out at home. My name is Dr. Carolyn Gibbs and I'm a clinical psychologist for the Children's Wellbeing Service at South West London and St George's. So many parents tell us that their child just won't go to sleep without them being in the room and without lots and lots of comfort and cuddles. If your child gets very, very distressed or really struggles to settle without any physical reassurance, what we normally suggest is that you start off by sitting next to them. And if they're very upset, you can put one hand on them just to show them that you're there to comfort them. And then as they settle down and become less distressed and calm again, the aim is then to remove your hand so that they really start to learn how to settle and fall asleep without you having to hold them. It's probably best not to hold hands because that's quite tricky to remove your grip when they're calm. And the aim is that over the course of a few days, or perhaps for some families it might take a little bit longer, you then want to increase the distance between you and your child. So you might start by sitting or standing next to the bed, and then further away, heading to the door, and then eventually allowing them to fall asleep whilst you're at the other side of the door, so that they no longer need you within the bedroom for them to fall asleep. And in doing this, they're much less likely to come and need you in the night time if they wake up. Once you're outside the room, if they do start to cry, it's absolutely fine just to wait a couple of minutes before going in. And actually some children are able to reset themselves after a little bit of time. But if they continue to cry, of course, do go in, resettle them, repeat your good night phrase, offer a little bit of comfort, and then leave the room again. If your child comes out of the bedroom, it's really important that you take them back to bed immediately and without really engaging in too much communication other than your good night phrase and again, a little bit of comfort, resettling them. Some children will come and say, they need a drink of water. So you might want to keep a small amount of water in a cup by the bed so that they can actually get that themselves without needing to ask you for it. It's really important that you're rewarding your child with lots and lots of praise for staying in bed. And again, if you feel it's appropriate, you might want to give them a low or no cost reward. And it's really important that that reward is delivered to them or at least talked about in the morning the very next day so that they get that positive reinforcement quickly and they really can recognise, I'm getting this because of what I did last night. Another common problem that parents come to us with is nighttime waking. First of all, it's important to check there might be a couple of things that are causing your child to wake at night. If your child is ill or poorly, it's actually really common and usual for them to wake up a bit more in the night, and they're much more likely to need a bit more comfort and support to settle than normal. We would expect that once they're feeling a bit better, things should settle back down again. Another reason that children will often wake is temperature. The optimum temperature for a bedroom at night is 16 to 20 degrees, so it's a little bit cooler than we think. So it might be necessary just to double check their bedding, if they've got the right sort of bedding for the temperature of the room, and is the room too warm or too cold. And also we know that children who are feeling a bit more anxious or worried about something might be more likely to wake up at night. So if this is an issue, we recommend that you try to address any worries during the daytime. And we've got a couple of videos all about how to support your child with anxiety on our YouTube channel, so do check those out. Children are much less likely to wake up at night and require your support to settle if they're able to fall asleep on their own without you in the room. So if they're not able to do this, it's much more likely they'll want you to help them to settle back to sleep. And if they're not able to do this then might be something you really want to prioritise. It's also important to remember that we want to keep stress levels quite low because cortisol is a stress hormone that really actually inhibits us to be able to sleep well at night. So as well as being mindful of your child's stress levels, it's also important to think about your own, think about your tone of voice and how you're communicating to them, and to make sure you take a bit of time to calm yourself down if you're noticing that you're feeling a bit more worked up. Another common complaint or concern that parents come to us with is bed sharing. So some families choose to co-sleep. If that's working for everyone involved, this is not an issue at all. But if you would like your child to sleep in their own room, then there are a number of steps to take to change things. So bringing your child into bed with you even if you'd rather not, essentially acts as a reward for their becoming upset or for their disturbing you. And it's this reward that then reinforces that behaviour, which then can become a habit. So if your child is coming into your bed at night, what you need to do is take them straight back to theirs without much talking at all, and just repeating your goodnight phrase, it's time to go to bed, or whatever it is you say just before they go to sleep each night. If your child has become an absolute expert in sneaking into your bed at night, whilst it might sound quite extreme, actually it's really important that you are able to wake up and get them back into bed straight away. So what we sometimes suggest is to attach a little bell to your door handle so that it will wake you up when you get in. Now this might sound torturous, and it will be hard and it will be exhausting for a few nights, but if you really want to do this, then it's important that your child gets put straight back into bed each time they come in, and that you're really consistent with this. If your child has been coming into your bed for a very long time, or actually falls asleep in your bed at night right from the start and is much too distressed to start going to bed in their own room, what we sometimes suggest is that if you've got the space, you could put a little mattress next to your bed so that they're in the room with you but not in contact, and then you reward them for staying on the mattress, and once they've done that for a few nights, you start to move them back into their own bed. And again, the key here is to use lots and lots of praise for any improvement made. And this might be a situation where you want to think about using rewards, because it's going to be a big thing for them to get used to sleeping in their own bedroom. So here, consistency is really, really key. So you need to persevere, and you might need to follow these guidelines quite often at first, and perhaps repeatedly over a period of days. And sometimes it will take weeks if you've got a child who's particularly anxious or worried about sleeping in their own bed. But it is important to persevere if this is something you want to do, because if you don't, what your child learns is that actually if they push against your boundaries, and if they're successful in getting the reward, which might be getting your attention or getting you to stay in the room with them while they're asleep or coming into your bed, it just means that that's what they learn. It works. So it does mean you have to be really committed and ready to make the changes. So it's not a good idea to do this at a time where you have any other stressful things going on, either in your life or theirs. So if you've got things going on at work, or other stresses or strains, or they've got exams coming up or tests at school, or anything that you think might sort of exacerbate their stress levels, it's not the time to do it. And if there are two parents or two caregivers at home, you really need to agree on a time that works for both of you, and find a time that works for you to kind of work together as a team, because you are likely to need each other to support with this, especially if you're having to get up a few times in the night. So once your child has learnt to settle to sleep alone, they're much less likely to need you to resettle in the night. But remember, it is important to know that sometimes you might need to go back to basics. As I said, if children fall ill, or if there's a significant change in their life, for example, a new sibling or perhaps a death in the family, you might notice a bit more nighttime waking. And again, that's really, really normal. Just stick to your consistent routine and things should settle down. So as we've talked about, praise is the absolute #1 reward, and we encourage lots and lots of praise. And as we said, some families where things might be particularly tricky for a child, low or no cost rewards are another way of encouraging your child's good behaviour. So this could be stickers or sort of low, no cost activities that you might be able to do together. And it's important that your child knows exactly how they're going to get the reward. So making it really clear to them, if you manage this, this is what will happen. And that every time they behave in the way that you want them to, they get the reward, and it's given as soon as possible. So that very next morning you talk about it when they wake up and give lots and lots of praise. And it's really important to say that once you give a reward, it really shouldn't be taken away, regardless of their behaviour, maybe the next day or if something happens. Actually, it's important to note that, you know, your child's worked hard to get that reward, and we don't want to kind of muddy the waters by then taking it away. And we know that many children like reward charts. So if that's something that you know your child likes, or something that you've done in your family before, that might be something you like to do. They can be given a sticker, like a star on the day that they've achieved their goal. And it's really good to have these charts somewhere in the house where everyone can see them. But it might not be that charts are for you. You need to find something that works for your family. And the achievements can be very simple at first. It might just be going to their room when they're told to, and gradually becoming larger goals, such as staying in bed once they're settled to sleep. So really do acknowledge any effort that your child's putting in and offer lots and lots of praise for their hard work towards their goal. So these are our top tips. And remember, changes occur gradually. It's not going to suddenly, like a miracle, get better overnight. But follow these and hopefully over time things will improve. So we've talked about the importance of consistency, offer reassurance when you need to, but trying to slowly distance yourself gradually. If your child wakes up, take them straight back to bed, repeating your goodnight phrase, and be really consistent with this. Be sure to be mindful of anything external that might be waking your child. So thinking about temperature, are they unwell, are there other things going on, and sort of allowing a little bit of lenience for these things, because we would expect children to perhaps wake up a bit more if they're experiencing these things. Perseverance, reminding yourself on those nights in the middle of the night, it's all going a bit wrong. Remember, it's not going to change overnight, but if you are persistent and consistent, things will get better. And remember to take your child back to their bed, not yours, if that's what you're working on. Reward those positive behaviours. Lots and lots of praise is what's needed. So thank you for joining with us today. Our final video, part 4, is going to be all about teenager sleep. Thank you.